Charlie is the second of our three Bichons, and he's really kind of a gentle, really cuddly, kind of quiet compared to our other two. He's a very easy dog to have around and very lovable. It started with, what you would see with someone who's arthritic, where it's a little harder to move. You would see him, in the morning. It took a while to kind of get going, and he loves his WALK. I'm not going to say the word because he'll probably jump up, but that became harder for him, and we were having to reduce the amount of distance we went with him and the other dogs, and occasionally there would be specific pain if he, did a stare or something that, kind of tweaked it further. So, there was a series of things going on where you could see that this was starting to impact his quality of life.
Basically, kneecaps that were not stable. This had been going on beforehand, and now injury directly to the joints, but evidence that there was previous injury because now there was arthritis in both these joints. So our options are surgical repair of the both joints in this case, starting with the more severe one, the left, and MRI examination of the stifle joints could also be performed to assess the ligament damage. So that's a lot to do. And the bottom line here is that there's injury, but there's also concurrent arthritis. So we started with various types of treatments: non-steroid anti-inflammatories, non-cortisone inflammatories, laser treatment, chondroprotective agents, which are similar to Cosequin. These are products that help the joint, renourish the joint. And that was continued till 11/16, when Patty has, at that time, met with a surgeon for a consultation.
So we had been monitoring both of Charlie's knees for a while, and indeed the left one was worse than the right one. And after going through a variety of options to try and make him more comfortable, we decided it was time to meet with the orthopedic surgeon. And that led us then to the discussion regarding the stem cell option, which I didn't know much about and was able to learn through the doctors at Little Silver Animal Hospital more about it. And in knowing my dog, Charlie, and in knowing what the issues were and the options of either surgery or the stem cell, I felt the stem cell would be a much more manageable procedure for him in terms of the stress, et cetera, that a surgery would cause. The stem cell to me was a minimally invasive procedure. And so then we began the discussions about the process to do that for Charlie. Charlie had the procedure in December of 17, and initially I could see improvement, but you have some restrictions when you when they first have it, so you're really holding them back from doing certain things, and I was cautiously optimistic. And then as he progressed, he was kind of pushing to do more, and we saw a pretty dramatic improvement in terms of I would say probably in the by February of 18 he was back on his walk schedule, doing that without any issue. We would see less of that kind of achy, arthritic kind of waking up in the morning. And fast forward to now, we're in August of 18. It's actually pretty miraculous. He gallops through the backyard. He can chase his sister dog around the island and make those turns without any issue in the kitchen. and you know is not living in pain, which I think is the most important thing. He's able to have a really great quality of life and be active, and there's really no signs of any issue with either of his rear legs right now.
Excellent. So I would say, Charlie, is it time for a walk? It's time for a walk now?
You want to walk or you want a treat? What do you want?